Gynecomastia is a condition that affects men. It is characterized by the enlargement of breast tissue in males, which can be a source of discomfort and embarrassment. This condition is more common than many people realize, affecting men of all ages and backgrounds. It causes the breast to grow larger than normal, which can lead to physical discomfort and emotional distress. The enlargement is due to an increase in the amount of glandular tissue as opposed to fat tissue. This happens when there is extra breast tissue. The development of this tissue is often linked to hormonal imbalances, particularly an increase in estrogen or a decrease in testosterone. Gynecomastia is usually not a serious problem, but it can be embarrassing for some men. The social stigma and personal discomfort associated with this condition can affect self-esteem and quality of life. There are many things that can cause gynecomastia. These include hormone imbalances, certain medications, and some health conditions. For instance, medications such as anti-androgens, anabolic steroids, and some antidepressants can contribute to the development of gynecomastia. Gynecomastia can happen at any age, but it is most common in baby boys, teenage boys, and older men. In newborns, the condition is usually temporary and resolves on its own. During puberty, hormonal changes can lead to gynecomastia, which often subsides as boys grow older. In older men, the condition can be linked to natural hormonal changes that occur with aging. The good news is that gynecomastia can often be treated. Treatment options vary depending on the underlying cause and the severity of the condition. In some cases, lifestyle changes such as weight loss and exercise can help reduce the appearance of enlarged breasts. If you are concerned about gynecomastia, talk to your doctor. They can perform a thorough evaluation to determine the cause of your condition and recommend appropriate treatment options. They can help you figure out the cause of your condition, which may involve blood tests, imaging studies, and a review of your medical history. Understanding the root cause is crucial for effective treatment, and they can discuss treatment options with you. These may include medications to address hormonal imbalances, or in some cases, surgical intervention to remove excess breast tissue. Gynecomastia is usually not a cause for concern, but it is important to see your doctor if you notice any changes in your breasts. Early evaluation can help rule out other potential issues and provide peace of mind. This will help rule out any other medical conditions, such as breast cancer, which is rare in men but still a possibility. Regular checkups and open communication with your healthcare provider are key to managing your health effectively, and it will give you peace of mind. Knowing that you have taken steps to address your concerns and that there are treatment options available can significantly improve your overall well-being and confidence. Hormones are chemical messengers in our body. They control many important functions, including growth and development. Two key hormones are estrogen and testosterone. Estrogen is often called the female hormone, and testosterone is often called the male hormone. Men and women have both of these hormones, but men usually have more testosterone and women usually have more estrogen. The balance of estrogen and testosterone is important for breast growth. In gynecomastia, this balance is disturbed. When there is too much estrogen or too little testosterone, it can cause the breast to grow. This can happen at any age, but it is most common during puberty, when hormone levels are fluctuating. Puberty is a time of great change for boys. Their bodies are developing and they are starting to produce more testosterone. This can sometimes lead to a temporary imbalance of hormones. As a result, some boys develop gynecomastia during puberty. This is usually nothing to worry about. The gynecomastia often goes away on its own within a few months or years. However, it is important to see a doctor to rule out any other causes of breast growth. If the gynecomastia is causing a boy significant distress, there are treatment options available. These include medication or surgery. Your doctor can discuss these options with you and your son. As men age, their bodies produce less testosterone. This is a natural part of aging. However, it can sometimes lead to an imbalance of hormones. This imbalance can cause gynecomastia in older men. Certain medications can also increase the risk of gynecomastia in older men. These include some heart medications, antidepressants, and medications used to treat prostate cancer. If you are an older man and you are concerned about gynecomastia, talk to your doctor. There are treatment options available and your doctor can help you find the best option for you. Section 5. Medications and gynecomastia. Certain medications can disrupt the delicate balance of hormones in our body. This disruption can sometimes lead to gynecomastia. These medications include some drugs used to treat high blood pressure, heart failure, anxiety and depression, and prostate cancer. If you are taking any of these medications and you are concerned about gynecomastia, talk to your doctor. Do not stop taking your medication without talking to your doctor first. They may be able to adjust your dosage or switch you to a different medication. Section 6. Health conditions and gynecomastia. Certain health conditions can also disrupt the balance of hormones in our body. This can lead to gynecomastia. These health conditions include obesity, liver disease, kidney disease, thyroid disorders, and testicular cancer. If you have any of these conditions and you are concerned about gynecomastia, talk to your doctor. Treating the underlying condition may help to improve your gynecomastia. Section 7. Diagnosing gynecomastia. A step-by-step approach. Diagnosing gynecomastia typically involves a few steps. It is important to follow these steps carefully to ensure an accurate diagnosis and appropriate treatment plan. Your doctor will likely start by asking about your medical history. This is a crucial step as it helps the doctor understand any underlying conditions or factors that might be contributing to the development of gynecomastia. They will want to know about any medications you are taking. Certain medications can cause gynecomastia as a side effect, so it is important to provide a complete list of all prescription and over-the-counter drugs you are currently using. And they will ask about your family history of breast cancer. A family history of breast cancer can increase the risk of developing gynecomastia, so this information is vital for the doctor to know. Next, your doctor will perform a physical exam. This exam will include a thorough check of your breast tissue to identify any signs of gynecomastia. They will feel your breasts for any lumps or abnormalities. The presence of lumps or unusual tissue can help the doctor determine the extent of the condition. Your doctor may also order some tests. These tests are essential to rule out other potential causes of breast enlargement and to confirm the diagnosis of gynecomastia. These might include blood tests to check your hormone levels. Hormonal imbalances are a common cause of gynecomastia, so measuring hormone levels can provide valuable insights. In some cases, your doctor may order a mammogram or an ultrasound. These imaging tests can provide detailed pictures of the breast tissue and help identify any abnormalities. These imaging tests can help to rule out other conditions, such as breast cancer. It is important to differentiate gynecomastia from other serious conditions to ensure proper treatment. Once your doctor has diagnosed you with gynecomastia, they can discuss treatment options with you. Treatment may vary depending on the underlying cause and severity of the condition. Options can range from lifestyle changes and medication adjustments to surgical interventions in more severe cases. Your doctor will work with you to develop a personalized treatment plan that addresses your specific needs and concerns. Section 8. Treatment options for gynecomastia. The treatment for gynecomastia depends on the cause and severity of the condition. Gynecomastia, which is the enlargement of breast tissue in males, can be a source of significant emotional and physical discomfort. Understanding the underlying cause is crucial in determining the most effective treatment plan. In some cases, no treatment is necessary. This is particularly true for individuals who experience mild symptoms or whose condition is expected to resolve on its own. For example, gynecomastia that develops during puberty often goes away on its own. This is because hormonal changes during adolescence can cause temporary breast tissue growth, which usually subsides as hormone levels stabilize. If treatment is necessary, there are a few different options available. These include medications, surgery, and lifestyle changes. Each option has its own set of benefits and considerations, and the choice of treatment will depend on individual circumstances. Certain medications can help to block the effects of estrogen. Estrogen is a hormone that can contribute to the development of breast tissue in males. By blocking its effects, these medications can help to reduce the size of the breasts. This can reduce the size of the breasts and improve the appearance of the chest. However, medication is not always effective for everyone, and it may take some time to see results. Surgery can be used to remove excess breast tissue. This option is typically considered when medication is not effective or when the gynecomastia is causing significant distress. Surgical procedures can provide more immediate and noticeable results. This is typically done in cases where medication is not effective or when the gynecomastia is causing significant distress. The surgical procedure, known as mastectomy, involves the removal of glandular breast tissue and sometimes excess skin. Making certain lifestyle changes may help to improve gynecomastia. These changes can include adopting a healthier diet, increasing physical activity, and losing weight. Excess body fat can contribute to the appearance of enlarged breasts, so weight loss can be beneficial. These changes include losing weight, eating a healthy diet, and exercising regularly. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains can support overall health and help manage weight. Regular exercise, including both cardiovascular and strength training, can help to reduce body fat and build muscle. Your doctor can help you decide which treatment option is right for you. It's important to have an open and honest discussion with your healthcare provider about your symptoms, concerns, and treatment goals. Together, you can develop a personalized plan that addresses your specific needs and helps you achieve the best possible outcome. Section 9. Emotional well-being and seeking help. Gynecomastia can have a significant impact on a man's emotional well-being. Some men feel embarrassed or ashamed of their condition. This can lead to social anxiety, low self-esteem, and depression. If you are struggling emotionally with gynecomastia, it is important to seek help. Talk to your doctor, a therapist, or a support group. There are people who understand what you are going through, and they can help you cope with your condition. Remember that gynecomastia is a common condition. It is nothing to be ashamed of. With the right treatment and support, you can manage your condition and live a full and happy life.